Okay, so I think we are almost good to go. Yes, we are. So welcome everyone to the May webinar series from the Ivan Research Institute, Nigeria. I'd like to say good morning, good afternoon, good evening from wherever you're joining. And we're here today for another interesting webinar. We're looking at the vital things that you need to have a successful concept note. You may have a good idea. Your intentions may be well thought through, but does your concept note reflect that? So we're going to be listening to a very erudite speaker this afternoon, and just give me a minute to share a bit about him. So just give me 1 minute. Want to welcome you all again. Welcome, welcome, welcome. Yes. Okay. I'm trying to share my screen, and I'm doing that now. So welcome everyone, and it gives me great pleasure to introduce our guest speaker today. He's a clinician scientist and he's a professor of pediatrics and epidemiology. He has medical and public health degrees in pediatrics from Howard University and pediatric infectious diseases from Rutgers New Jersey Medical School in the US, where he also obtained his master's in public health. He is the director and the founder of Ivan Research Institute Nigeria. He's a global leader in implementation science and has over 2 decades of experience in research, particularly in implementation science. And he previously directed Nevada's Comprehensive Maternal Child HIV program, that's in the US, and has advanced implementation science to improve health services delivery in maternal child health and infectious diseases. So without much ado, just let us welcome Professor Echezona Ezanolue as he takes the floor and guides us on writing a successful concept note. Welcome, Prof.
Thank you so much. Thank you. Thank you for that introduction, Professor Nyaka. I only want to say one thing to it. I say in all the introduction, Professor Nyaka forgot to mention my most important degree, which is my degree from University of Nigeria, where I obtained my MBBS degree, because that is where you all started. So it is that same concept that I had when I was at the University of Nigeria. I asked myself as a student, doing all I could do, like everybody does, and graduated. But when I went to the US, I began to see a lot of difference in terms of training. And I began to take a book. I call it the Idea Book. It has been, you won't believe it, it's almost 30 years of writing those books. I have many, many bundles of them. My wife laughs at me because I keep them in office, and you say, when are you going to throw away these? But I take it, and anytime I have an idea, I write it there, and I call it the Idea Book. But this idea has spread over a period of time to the place where we are today. Over the period of time, I started to enjoy research. So it wasn't one of the things that was part of our medical training, as most of you will remember, who went to school 30 years and above, medical school in Nigeria. But one thing that was certain as I got there, I found out that I enjoyed it. I taught myself basically how to write grants by writing and writing and writing and failing and failing and failing. But each of those places, I always make fun of it, because I remember the people in my office asked me, why is it that whenever you get review from the office, you're smiling? Did you know you didn't get the grant? So I look at them, do you think I'm crazy? I don't know I didn't get the grant. I say, I know I didn't get the grant. They say, why are you always smiling? At the time, the only grant I was writing was NIH grant. And what they didn't understand and why I liked the NIH grant then was I wrote a few grants and they say you didn't get it, but they don't give me any feedback. It didn't make me any better. But when I wrote the first NIH grant, there were 3 reviewers that reviewed my grant, And on each of the review criteria, they gave me my strength, they gave me my weakness, they told me what was well and what wasn't well. So this kind of drove my attention to really write. So I say that the NIH, writing NIH grant taught me how to write grants. And along the way, I've been opportune to meet mentors who have actually, I'll tell one of them. Most of you may know him, Gbenga Ogedegbe. He is Nigerian. He has NYU, but he was one of the first people who actually said, here, this is a full grant for you to see how to put together a grant as you come up with your idea. This is something most people wouldn't do. This is something most people didn't do for me, but he did. So I put it in my idea book that if I ever get a grant, that I will share my grants with people so that they can see how to put the ideas together. And that is what led to Ivan Research Institute with one purpose, really, is the belief that to them who have, more is given. And when more is given to you, to them who more is given to, more is expected. And this is when you give back a little bit there. So over years, I've written grants. I've been successful in some of them. I've failed in most of them. I've had a chance to review other people's grant. And each time that I review those grants, I learn so much because each time I score an excellent grant, I ask myself, why did I score this grant high? What was the thing in the grant that moved me to score them high? So I wrote them down. And each time I score a grant poorly, I also wrote them down. Why did I score this grant poorly? So this helped me as I improved myself to be able to say, those things that made you give a grant very good score, then you need to incorporate them into your writing. Those things that didn't make you give them, then you want to make sure you are aware of them. So over time, we've come up with this idea. This is a three-series thing, but I'm going to focus on one of them. It's the concept note, the abstract, the manuscript. But today we're just going to focus on the concept notes. So the concept note is quite essential in what you do. It serves as a foundational document that communicates the ideas that you want to both the reviewers and the funding agency that are going to fund your. It is also the first thing that actually you help you to bring people into your grant, your investigators team. So if you're trying to write a grant and then you said you wanted me to join that, the first thing I will ask you is, so what is the concept? So what does it look like? So you find out that it will help you in building a grant winning team. It will help you with the reviewers. It will help you with the funding agency. It is typical, very short. In some cases, like the NIH grant, it comes as specific end page, which is 1 page. In other places, it's 2 pages, it's 3 pages, but usually less than 5 pages. You really focus on identifying the problem, the proposed solutions, the objective, the method you're going to use, and the expected outcome. One of the other thing about it is that in some grants today, most of you may have involved in, you find out that there are 2 steps. So the first time will be to submit a concept note, and then you are invited to submit a full proposal. So you can find out that the concept note is your gatekeeper. It is the thing that will make or break your projection into those. So the purpose of a concept is really to communicate an idea effectively and efficiently. And those 2 words are very important. You are given 1 page to be able to write this grant and put all of these ideas in the whole idea. Like I said, it provides a quick overview of the proposed project. It allows funding agencies to assess the relevance and feasibility. It serves as a basis for feedback and refinement. And like I said, in the 2-step, it acts as a precursor to proposal. But writing those 1 page is one of the most difficult things because your idea is bigger than 1 page. How do you provide your idea to them? And what is it that the reviewer is looking for? Somebody asked me, if you have been reviewing, what is it that you are looking for? If you can describe in 1 word, what are you looking for in a concept note or specific end page? I say in 1 word, I'm looking for clarity. So that is what you have to always put in your mind. Clarity. By the time I finish that 1 page, I should be able to know 5 things. So those are the things that over time, I started to put them together into words as a reviewer. And I said, what are those things that I'm looking for? That by the time I finish reading that 1 page, before I get to the other page, because I was listening into it and they said, oh, the specific end page is there. By the time people finish reading the specific page, they already will classify your grant into three: the good, the bad, and the ugly. And they'll put it in those bucket. And as they begin to read the next of it, they are looking for, yeah, these are human beings. They are not AI. And maybe AI will be doing the reviews. I'm sure there will be in future a comparison between reviews done by AI and reviews done by reviewers to see whether they're, but for now, they are humans. So they are going to be looking for certain things. So over the years, as I reviewed this grant, I came up with these 5 steps that I call the 5 easy steps. And those easy steps is really what is it that I said at the end of that specific page, at the end of that concept note, I want to know. So I want to know what the problem you're trying to solve. That is the first thing I want to know. So if
Yeah,
if you don't
Prof,
provide me
briefly,
clarity to,
Prof, just 1 second. Are you sharing your slide because we can't see from this end?
thank you. So you are good then that you told me that.
Yeah.
So let
Okay.
me see. Okay. So I was sharing my slide, but that is where I am. And what I talked a little bit was about this. So
Yeah. Thank you.
the concept note tester, thank you so much for bringing it early enough before we finish. So I talked a little bit about the essentials. It is the same thing that is on the page. I talked about it, but here is where we are, which is very important to thank you for bringing out that. So these are the 5 things. So if you want to go after this slide, you can leave because we are finished. The only remaining time that we're going to spend on this grant is really to take example and then a little bit more detail into this slide and then get questions from you. Just remember that I won't take questions that are in the chat, so the questions should be in the Q&A. And if you put them as we go along, it's better for you because we will take the questions. My hope is that we will spend about 30 minutes on this, and then we'll spend the rest of the time on the questions and being able to respond to those. So those are the 5 things that I've come up with that I want to know if I'm reviewing a grant, what the problem they are trying to address. There are so many problems. Don't list problems you are not going to address. So it is not telling me that poverty is a problem in Nigeria. Yes, poverty has always been there. And I am very certain that your grant application will not have a cure for poverty. So don't do that. Be able to be clear about it. Poverty that led to people not going to school and then not being educated and not being able to have knowledge, health knowledge about that. Then you are telling me what poverty costs that you can change because you can increase knowledge, but you are not going to be able to, in your grant application, cure poverty. So remember those things that you have to be clear about the problem that you're trying to solve. The next thing is where people forget is that you have to have a discussion of what is known about the problem. You have to be able to do that. And that is where evidence synthesis is important. I was telling someone, he said, if you have a postdoc and you're trying to hire somebody who have finished their PhD and has spent, if there is one thing you would like them to know how to do, what will it be? I say, I want them to know how to do 3 things. One of them, I want them to know how to do a DEX review. I want them to know how to do a scoping review. I want them to know how to do a systematic review. Those 3 things, if they know how to do one of them, that's very critical because in my career, grant is the way that I support what I do. Every good research requires money. If not, we do the same thing we're doing in medical school when we didn't have money. We do KAP, knowledge, attitude, and practice, because it was where our money can go. But the real research actually goes beyond that and requires money. So you want to be able to write grants. So in doing that, the second thing you want to be able to do is to describe what is known in the literature, and which you can only do by evidence synthesis, what is already known. Then the third thing that you're going to do is to be able to identify the practice and research gap that exists. So if all of this is already known, what is the gap? What are you? Because every time you're going to do a research, you are going to fill in either a practice gap or a research gap. So you want to be able to provide clarity. Again, remember there's one word in all of this, clarity. So that if I can identify these 5 things, then you have provided clarity. So the fourth thing is that what do you propose to do? So what do you propose to do about this gap in practice or gap in research? Then how are you going to do that? How do you propose to do that? So these are the 5 things that by the time I finish this and you have provided me clarity on these 5 steps, that grant goes into the good. Some clarity, that grant goes into the bad. No clarity, that grant goes into the ugly. So these are 5 steps that I want you to remember, and we're going to go into them a little bit, each of them, to talk a little bit in more detail to what it is. So if you want to define a problem, it has to be clear, it has to be concise, it includes the scope, the significance, impact on target. And someone say, how can I do that in a very short? Remember, you have 1 page to write all of those things. So this is when you want to be able to describe what the problem you want to solve. I will give you an example. An example is, say, you said, okay, there are 300,000 children born with sickle cell disease each year in sub-Saharan Africa. 150, which is 70, almost 75% of those children born are born in Nigeria. I am saying only an estimated 80% of these 150 children in Nigeria will die before their 5th birthday unless an intervention is provided. So you have clearly, if your problem statement is not jarring to the reviewer, then you're asking yourself, how will the funding, because there's so many applications, how would they know why your project is necessary and relevant? You're telling me that Nigeria accounts for, 75% of people born with sickle cell in the world. And in Nigeria, there are of this 150,000 that is born each year, that 50 to 90% of them will not see their 5th birthday, except appropriate intervention is provided. Even if I don't know what sickle cell is, I will come out knowing it is bad. So that is the kind of statement you want. You can apply this to whatever your study is. You can apply it to whatever. You can talk about stroke, you can talk about hypertension, you can talk about diabetes, you can talk about HIV, you can talk about vulnerable disease, which are some of the things that I've learned over the time. But you can make it specific to the problem, but that problem should make somebody that is about to drink water hold a glass for a minute to sink in that 90% of a population that is born in a year will not see their 5th birthday unless the intervention you want to provide better be good. But that's the one place you start. That's your first hooker of the person. You want to stop that cup moving to the mouth for the person to say, wow. Then you want to describe what is known about that problem. And I'm going to keep to that sickle cell as an example so that along the way you can see how I think about it. So in that second step, you want to say, you want to review the literature. You want to look at reports. You want to look at data that summarize current knowledge. When I write those things, I usually focus on 3 or 4 things. So people say, oh, I want to review literature. Where do I start from? I start from 4 different places. I want to look, have there been a recent systematic review? You can see why I love systematic review. If a good systematic review have been done, they've done a lot of job for you. So if it has been done and it was done, remember that if a systematic review is published in 2025, that probably the last data they have is probably 2024 or 2023. If it was done in 2024, the data they have was 2023 or 2022. So you want to look between that time it was published and look a year back. So if it was published in 2024, you want to look between 2023 and 2025, what is new that been added so that you can make that systematic review even more current. But that is where you start. They have, if it's done well, find people that have done a very good systematic review. And in another session, when we talk about systematic review, we can talk about how you decide a systematic review is good. Take that because then look through, read that article, and then look at the individual citation because that's what a systematic review does for you. They have pulled very good papers, very good things, and put them all in that systematic review. So that's one document you want to have. The second document that you want to have is really that you want to have a guideline. Is there a guideline for identification and management of people, children with sickle cell disease? You want that guideline. If there is a WHO guideline, I will get that WHO. And then depending on the agency, the funding agency that you're trying to refer, I want to be able to get it. If you're applying to the US, I will look whether there's a US guideline. If you're applying to NR in UK, I want to look at European continent. If you're applying to CIDR Canada, I want to see if there's a guideline in those places. So that would be the second document that I would make sure that I download. Usually in my time, I print all of those things and put them on the floor. When I begin to write a grant, the first thing I put is please do not clean. So I take that sign and put on my door so that the cleaners do not come out and take anything there, because I did at the time there was no citation manager. So you have to lay your things as you cite them so that you can write your own bibliography. Right now, if you're writing a grant and you are not using citation managers, you are doing it in my 30 years ago. That is bad. That is not a good approach. You should be writing as you're having a citation manager. Things are much easier now. So you want to make sure that as you read those systematic review, as you read those guidelines, you're beginning to pull the articles. So I lay them down at citation 3, 4, and by the time I finish, most of the time there are 100 things lying on my floor. So that's why I say cleaners do not clean this office. But you want to go again to be able to see that is there a policy statement? Then you want to be able to see, are there any patient-facing something like perspective from patients, perspective from parents, perspective. So these are some of the things you're able to gather because you want to be able to show that. I remember the first time I wrote a paper. It was a short paper. I came to the US, wrote my first paper, well, actually my second paper, because my first paper that was in medical school at the Medical, it was a medical school journal of the University of Nigeria. It was the journal that actually made me find out that, wow, I like my name on print. I like this stuff. And that is actually my research, my career began to take a different pathway, because I told myself, to your own self, be true. Follow the things you like. If you don't like research, don't do it. It's not better than anything. So don't do research and think every other person is not important. You're making a mistake. Follow the things that are interested to you. If you like to do clinical, and that's all you want to do, be the best clinician that you can. And if you want to do research, people forget that clinicians also do research, because most of the research that is done in health is done on humans, is done on cohorts. So if you are a clinician, build up your own cohort, build up, focus, be a good clinician, and you can bring that to the table and find other researchers that you work with on doing research projects. Just because you're a clinician does not mean you don't do research. It just means you bring something different to the table. So those are the ways that I think about it. So as you move forward from here, you want to be able to show the proposal is grounded in existing evidence and informed by best practice. So that's what you want to be able to know. This is what is known. This is what is, then you are able to, because if you don't know what is known, you won't be able to know the third thing. The third thing is to identify the practice or research gap. So again, as you're doing that, you want to see, where does the current diagnosis fall short? Where does the current treatment fall short? Where does the current service fall short? You want to see that. You want to look at some of those things you think are short. Is it in accessibility? Is it in affordability? Is it in the quality of care? Is it in effectiveness of current services? So you want to identify the unmet needs or insufficient evidence. Caution here. When you want to put this part, you want to look at what I call modifiable. So there is no reason for you to put unmodifiable thing unless your intervention includes giving everybody, like Elon Musk just told us, that when AI takes over, we are not going to have a job, but the government will not give us money for all of us to have money. That's funny, because everybody thinks money is the reason people work. Money is important to work, but there's actually self-fulfillment that comes from work that people forget. So you want to make sure that you are not saying things like poverty, 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 unless your solution also includes $1 million to everybody that will help them get out of poverty. I don't think $1 million will do it, because they will eat it. And if there's no production, the 1 million will still finish. So why am I saying this? It's important not to list, not to go into the idea of just talking about the gaps, the gaps, the gaps. Listen to the gaps. Understand the gaps. Think about modifiable gaps, modifiable knowledge, things that you can do something about and be able to overcome that. So if you're thinking, like I said, if you're thinking about poverty as a thing, and you say poverty does not allow people to have to allow them to live in places that are close to cities where you have hospitals, they live in rural areas, and because they live in rural areas, they have problem with accessing the health facility. That comes into accessibility. So even though accessibility is poverty, affordability is poverty. If you go to the quack hospital, quality will decrease. If you're not, so all of those can be tied to poverty. But you're not going to come out there and say the gap here is poverty. Poverty that costs what? That is modifiable. So this is one place that you pay attention as you synthesize that evidence from the literature. You begin to say what are the gaps and what are the gaps that are modifiable. So then when you have done that, because that is there, one of the things you don't want to do is to put in a gap that does not have a solution in your grant. So if you want to be able to put a bundle of intervention, you want to focus. Instead, you can say in that specific game, remember, when you go into the grant, when you can write a whole page. That time you have 12 pages, however many pages they give you to write, you have all of that to focus on the problems. But here, you have one page to talk about these 5 things. So you want to be able to do that. So here you want to be able to say, among the problems, these problems, so you can limit that by yourself on showing that there are more problems, but these are the ones you're going to focus on. So you want to be able to add what you propose to do. So what is your proposed intervention or program activity? The target population, the resources, the timeline, the innovation, because you want the reviewers or funding agency to have a clear understanding how investment will be utilized. I remember one time I called someone and said, there is so many grants. As I started to review grants, I understand the challenges that reviewers have. People apply for a grant, let's say there are 4 awards, and 40 people apply for this grant. And then you score them. And the difference sometimes, a score of one, if I'm talking about NIH grant, where 1 is exceptional, 2 is outstanding, 3 is excellent, 4 is very good, 5 is good. Then there's 6, 7, 8, and 9 that is not that good. So I said, and you look at everybody's 1, 1.3, 1, 1.2, So at the end of the day, how do you decide? So these are very competitive grants that are happening in those places. And you want to be able to say, how do you pick the best one? So they rank those things by then and they said, okay, it used to be 50% we're going to discuss, 50% we're not going to discuss. If you write NIH grant, then you realize that has really changed now. They started doing 30% we are going to discuss, 30% we call it competitive non-discuss. So the next 30%. So these are good grants, but we know only 4 that we're going to fund. Well, so we pick this other one, but we leave this one here to allow the programs because things have changed. It's not just about this cause anymore. The programs will look at diversity in terms of where is the grants coming from? Is it in this part of the world? What is the disease? If you're talking about cancer, maybe they want some cervical cancer, some anal cancer, some lung cancer, instead of all of them being cervical cancer. So there is opportunity. They will pick from the second 30%, which is called the competitive non-discuss. And of course, there is the non-discuss. So those have changed over time. But in this place, you want to explain what you propose to do. And remember, what you're proposing to do must be aligned to the gap you identified. I've seen people list this gap and then they go tangential on what they propose to do, and none of them is connected on solving the gap they discovered. I mean, that grant is going nowhere. So those are why these steps are very important for you. Then the last thing that is in this step is you want to look at your methodologies, looking at how are you going to do it. Everybody in my team knows one thing they will tell you. They will tell you that grants die at approach. So when the evaluation used to be 5 evaluation, now there are 3 or NIH grant. So they will look at the significance of the problem. My team always scored well about it. They will go to the person and talk about the investigators, innovation. My team scores well on it. They go talk about the investigators. My team scores well on it. They go to the tabs in terms of research environment. We make fun of it because almost even grants we don't even get scored at all. We get 1-1 for research environment. Remember, this 1-1 we get now is only when I'm in Nigeria. In my career in the US for 25 years, I never got 1, which is exceptional, from 3 reviewers on research environment. Never have I done that in my career, except when I actually went to Nigeria. And my research environment has been 1-1-1 from reviewer. We just got a review this last week. We still went there. It was still 1, 2, 1 from reviewers about exceptional research environment. And we can talk about those things down the road. But this is where you try to do that. How are you going to do it? And I tell my team, if you can score 3, which is excellent in approach, that grant you will get, because this is where you now. So you've talked all of these things. You talked about what is the problem, what is the issue. You talked about what is known about the issue. You talked about what is gap. You talked about what you propose. The last question is, how are you going to do it? So this is where you have to talk about those data collection, analysis, staffing, logistics. Remember, in this one page is just to show those things. But then as you move forward, you want to entitle them enough to know that you thought about these things. So in your methodology, you want to be able to say, site will be recruited from 12 sites across 6 regions of Nigeria. You want to put those things that are attractive for them to know that you understand the data collection, you understand recruitment, you understand all of those things. Then you go into detail as you go to those things. So these, again, is the 5 steps. So if you're still with me and you want to leave, this is the last of the part of the things again, because we talked about these 5 steps. We talked a little bit more about detail about them. What I'm going to do is really to take an example from another area to be able to show that. But I wanted to specify, this. The NIH grant, like I told you, I love NIH grants, not because they are the only grants, not because they're actually the least of the money. When I look at the NIH grant, I look at Wellcome Trust. If money was the issue, please go for Wellcome Trust, because they will fund you more money than NIH will. But what I liked about NIH, especially for a beginner like when I started, is because of the reviews they provide. I see the review that come from every other grant, Wellcome Trust, CIDL, none of them, they pair to the review that you get from NIH reviewers, because they spend time actually in giving you the strength, the weakness, the strength, the weakness, the strength, the weakness from 3 different reviewers. And if it was scored from 16 reviewers giving you a feedback, it is one of the most training tools that I found. And in those specific M page is 1 page. You have to state that overall goal. You present the 2 to 3 measurable, feasible aims, align with hypotheses, provide rationale and expected outcome. I know that what we are doing today is an overview of this, and I will talk a little bit about it if you are interested in developing these things further, what opportunities that you have to be able to do them. So let's talk about this. We are trying to implement a telemedicine program in rural communities. And I want to use those 5 easy steps concept to be able to do that. So talk a little bit about the background. The study outlines a pilot study implementing a telemedicine program in 12 rural communities. The intervention includes virtual consultation, remote blood pressure monitoring, and patient education session. This is actually a current grant that we have from NIH, a 5-year study that we have across 12 sites across the 6 regions of the country. So we're talking about a mixed method design that will evaluate clinical outcome and patient experience over 12 months, aiming to address gaps in rural health delivery. Then you start to the first one. So again, what is the problem? This is your problem statement. The rural communities face barriers to quality healthcare, especially for chronic disease like hypertension. Challenges include limited infrastructure, geographical isolation, and shortage of healthcare professionals. You want to make sure that you see that limited infrastructure, what will you do about it? Geographical isolation, what will you do about it? Shortage of healthcare professionals, what do you do about it? But you can begin already to see where telehealth can do that. You can see where infrastructures, because of telehealth, can do that. You can see where geographical isolation, because of telehealth, can do that. You can see where shortage of healthcare professionals, telehealth can do that. So again, you are beginning to put that in place. Remember, the problem statement should not include things you don't know how to solve. So that's one thing that I want to make sure that you remember. So you want to talk about the existing knowledge. So you said research demonstrate that telemedicine can improve health outcome. Remember, in these places, especially everything you say there has to be fact. I always say, when you finish your specific aim, you have, some people put citation in specific aim, some people don't, and there is no right or wrong one about it. But in that specific aim, you should have your statement of fact, the most important fact about your statement. So when you say research demonstrates telemedicine can improve health outcome in underserved population by increasing access to care and enabling remote monitoring, you want references here. You want citation here. And not one, not 2. This is one of those places I put 3 or 4 to show that different studies that have demonstrated that telemedicine, so that telemedicine is known to work. Then you say previous pilot studies have shown reductions in blood pressure and improved patient satisfaction when telemedicine is used for hypertension management. So let's say you call them, you want to see how much blood pressure there, because they cannot come to clinic every day, but they're able to measure the blood pressure at home, or like we do, they're able to measure it after church or after mosque on Friday, or after church on Sunday. And then those information are related in a way that you can use them to mental health to be able to do that. So you want to show those things. Again, the pilot studies, those are not pilot studies. It's not pilot study. So it's not one reference. It's not 2, if possible, 3 to 4 citations that show the pilots that have shown that this that works. Then you want to go to the third step. You want to talk about the gap identification. It said, despite promising results, telemedicine adoption in rural area remain limited due to infrastructure and resource constraint. Okay, so despite evidence supporting telemedicine, few studies have implemented comprehensive program in rural setting, and there is a lack of data on long-term sustainability and patient engagement in these communities. So you have coming in here to be specific now about the gap that you see. That, yes, there have been these pilots that have shown pilots are good. But that's really what is missing here is there's lack of data on long-term sustainability. So that's where you want to focus, or patient engagement in this community. So if you want them to screen one day in church, they will. How about going to church every day and screening and checking their blood pressure? Remember, you're supposed to monitor your blood pressure every day, 365 days if you have hypertension. But you're saying even to do it for once a week when you come to church on Sunday, or when you come to mosque on Friday, and you're actually saying how many people sustain that. So you're looking at long-term sustainability of that. So you have identified the gap. You're not talking about the lack of blood pressure machine and some of those. That's still there, but you're picking the one that you want to be able to say where after this study, you will be able to contribute. So you have to remember that is your output. You have to provide data on long-term sustainability and patient engagement. That becomes a very important gap that you have identified. The fourth one is that what's your proposed intervention? So you talk about the virtual consultation, the patient education session, the remote blood pressure. So those are the 3 things you're trying to do. And you're putting them here because the reviewer say, okay, I want to see when I now reading what is the virtual consultation, how are they going to do it? Our patient education session, how are they going to do it? Remote blood pressure monitoring, how are they going to do it? So, but these are things you're able to lay down in those places. In the last step, we talked about methodology. So it's a study will be conducted in 12 rural community over 12 months. Participants will receive devices and training. This method designed to outcomes, blood pressure, patient experience. So again, and data will be collected at baseline, 6 months and 12 months. So you're able to bring some of this element of your methodology into that specific end page before you there, or your concept note before you go there. So like I said, we are come to this conclusion, and we can spend the rest of the time. I think I didn't make it to 30 minutes, but we have quite some time to be able to do that. But this is my last thing to say here, that concept notes are essential tools for communicating project ideas and securing funding. The 5 easy steps set clear, structured approach for you to developing a compelling concept note that articulates the problem, summarize the existing knowledge, identify the gaps, and propose feasible evidence-based solution. And when you do apply for it, it is very well. I do want to tell you about 2 programs that you want to be able to know that is available for you if research is something that you are interested. The CTL Scholar Program is in the East 5th cohort. We started this by when the pandemic started. We couldn't do a lot of, we used to do workshop, physical workshop in Nigeria to improve research. But when the pandemic came in 2020, we started to do virtual, like what we're doing today. And the CTL Scholar Program is a 1-year program divided into 2 parts. 6 months is to 24 weeks is didactic. So you will follow the directive of every section of a grant. And we spend that time. And after that, each person is assigned to a primary mentor, and I act as a secondary mentor for everyone that accepted into the program. It's a very popular program. When we started it, we thought it was there, but this year we got 169 applications. We have 39 applications from physicians. We have 29 applications from PhDs, and we're doing something different this time. We're actually bringing in the doctors, the MBBS and the PhD people together. But there is something that is required for this. And I want to make appeal to anyone that is listening today and have been blessed by somebody mentoring you, somebody providing for you to start, somebody who added to you, and now you have been able to submit grants. We need mentors. We are only able to accept 10 people out of these 169 applications. Why? Because we only can accept people when there is a mentor for them. Because we find out that mentor, everybody needs a hand holding to get you across that last step. You have now done your bachelor's, you've done your master's, you've done your PhD, or you have your MBBS, and then you want to follow research pathway. You have done your residency, you've been a house officer, senior house officer, registrar, senior registrar, consultant, and you still want to be able to do that. You still need that hand holding a little bit, a mentor that can show you their grant, go there, show you all of those things, open up to you, open up those things and show you there. One of the things when I came back to Nigeria, I remember opening a Dropbox and putting my grant in it. And somebody said, "Are you crazy? Why would you put your grant in there?" And I told them the story I told you at the beginning about when God Getaway, who at the time sent me his own NIH grant, complete. This is with budget, with everything. I say, here is my grant. And the promise I made to God that if I ever get one grant, that I will share it for people. One thing else that we're starting also that is interesting is that we're going to take the CTL Scholar Program over time as a certificate program, and that may be all you want to do. Then if you want to do more and you wanted to get a PhD in implementation science, we're starting the first PhD in implementation science in Nigeria. For most of you who know about the Nigerian Implementation Science Alliance, that is the only way why this is possible. It is supported by the partners across there because what we're doing is an embedded implementation science, which means the last year of that PhD, you will serve as a resident implementation scientist in one of the implementing partners, and I will show that along the way. So this is one thing. The last thing I want to show you is this picture, and people may not understand, but I showed it somewhere and they laughed about it, so I want to show you. So this is me and my son, and this was when he was 10. You can see me as the father. He was just to my shoulder. He was going, you see my hand across his shoulder. And this is how life is at the beginning. You are the most knowledgeable in the office. Most of the time, I sit in a room where I am the most knowledgeable, trying to impact people with knowledge. But I have one objective. So here I am, the tall dad. My son is to my shoulder, and I am the big guy in the room. Most people want to remain this way. They want to remain in a room where they're the big professors, and they're afraid of giving, because if they give, then those people might grow better than they are. But if you look at my son at 15, you can see that, he's still growing, but already I'm dropping to his shoulder. Very soon, I won't be able to put my hand around his shoulder because he's become taller than I am. And why quite taller? This is him at 15, he's 16, and he's much taller than he is here now. So I'm decreasing every day to his shoulder. Nothing happened to me. I'm still his dad. And that's what I tell people. You're a professor, you're a mentor, you have done that. What you want to do is to pour into your mentee so that they can become taller than you are. That is the joy about it. Don't hold back. Don't think I have to reserve something to make me the professor. The idea is to give. You have attained your own. Give. So again, why am I saying this? We need your help with with mentoring. So if you think you have the capacity, Professor Onyeka is going to provide you an email. Please let us know that you want to serve as a mentor to someone who is starting their career and be able to do that. I want to give a shout out to so many organizations in Nigeria that made this possible. We do these webinars, we do the weeks, we do the NISA conference. All of those are continuous programs that we've had to increase capacity and skills among Nigerians. So each of these people, I want to tell you a little bit about the NISA conference, and I think Professor Onyeka will talk more about it, but we did in 2015 when we started this, the registration fee was $100. Last year, when we did our 10th conference, the registration fee was still $100. And I pay $850 to register for a conference that I go to in the US that does not provide me anything more than coffee and knowledge. Of course, they provide me quite a lot. Here, we provide you the knowledge, we provide you the coffee, but we actually have a really nice network program. We have lunch served, we have a gala night that is there for you to meet a lot of the investigators here. So I really encourage you to try to plan to come there. This time is September 2nd to 4th in Abuja Continental Hotel. But those things are made possible by all of these partners in Nigeria. They are the ones who said, you know what, we want to give back. So they give back. I don't want to tell you, last year we had people give us 45 million. 45 million, two people. This year already, we have already had people give us 45 million, 30 million to make sure that the conference price is left low so that people can live. So wherever you are, I want you to give a shout out and give a thumbs up for all of these organizations in Nigeria that have supported what we do in terms of providing this. And then thank you for listening.
Thank you so much, Prof. This is vintage Professor Echezona Ezanole, as usual. So you held us spellbound. In fact, myself, I was like, oh, this should continue, but for time. So there are quite a number of questions coming up. And let me start with those questions because they're actually rolling in. The first question is from Constance Azupike, but I'm not quite understanding it. She needs to, Constance, if you're still there, please, can you rephrase your questions? And for those of you putting the questions in the chat right now, please move it to the Q&A. Thank you. So her question is, it says, when you're writing a concept note on the research on congenital rubella syndrome, she says, she said, help to describe the problem. Do you understand what she's trying to say?
I don't, but I'm a pediatrician and I'm an infectious disease doctor. So if I'm writing about congenital rubella syndrome, this is how I'm a pediatrician. And somebody looked at me one day and said, I haven't seen you done any research in pediatrics. I say, I do. He said, but you haven't. I said, because all my studies are focused on pregnant women. Why? Because I'm a more of a preventionist. So congenital rubella syndrome, when it happens, there's not much you're hoping. So I'm hoping that if you're writing this grant, you're hoping about how to prevent it among women, and then how to, by getting their rubella vaccine. So you're trying to increase that vaccine among pregnant women or reproductive women, or you are looking at early diagnosis of condition, so you can do something. So I don't know what it is that is specific on, but I'm sure that in this area, these are the two things that you want to do. Either you're trying to prevent it or you're trying to do early diagnosis, because once you have congenital rubella syndrome, you have congenital rubella syndrome.
Okay. So before I go to the next question, which is from an anonymous attendee, just want to shout out to all the people joining us from outside of Nigeria, from Ghana, from Ethiopia, from Senegal, from all parts of the world. Please, you're welcome. So our next question says, thank you, sir, for the presentation. What is your advice about getting a good score on research environment? So it's talking about the NIH grant that usually does the research environment. How can you optimize your research environment if you can't change that environment?
This is a very good question. So one of the things that that is that when I came back to Nigeria, the first time, I went back to my institution where I went to Medical School, University of Nigeria, and then we actually started the Center for Translation and Implementation Science there. But over time, one of the things we have done is that we have NISA, the Nigerian Implementation Science Alliance. And one of the things about NISA, as I showed you from that slide, was the national part of it. So we decided, you know what, we are not going to do things that are focused in one area. And that's one of the things that actually the Ivan Research Institute was now set up as an independent research institute. We're really acting at the research, what I call Evidence Synthesis Center for the Nigerian Implementation Science Alliance, and the research coordinating center for Nigeria. So what we said to do with the support from all of those NISA members, we built out the practice-based research network. A practice-based research network is a primary hospital, community hospitals that are there. So we had 12 community hospitals that are two from each of the regions of the country. And then from there, we connected them to the 12 communities where they are. And from there, we connected them to 12 teaching hospitals. So the 36 part of it is what we call the NISA Icon 3 Practice-Based Research Network. It is something that you can use, any Nigerian to be able to use that, to be able to do your research. So if you have a research idea, and then of course, we're able to work out how to work for you to use that infrastructure, and you can use those infrastructure to be able to do your grant. How do you do that? There is an email that is put down there. If you're, depending on the stage where you are, if you're at the beginning stage, I would say apply for the CITIA program. It is one way that you get a mentor to hold your hands and advance you to be able to do that. If you are in a place, you said, you know what, I have done my thing, I'm a consultant now, but I really want to understand, or I want to get more into research, and I want to get my PhD. For those who have an MBBS, getting a PhD have two purposes. One is that it resets your clock. So let's say by the time you're a consultant, you're no longer an early stage investigator. It's more than 10 years, which is usually the case from your graduation to when you become a consultant and all of those things. But getting a PhD begins your career again at zero. So you become early stage investigator because you have moved from a clinician to a clinician scientist. Just like I don't have a PhD, so it's not like it's necessary for you to be able to do that. But it is one way people do with masters. I have a master's. I expanded my own knowledge, and then after the masters, instead of doing PhD, I decided to do a fellowship in health policy, do a fellowship in sickle. So I decided to use the policy fellowship way, but you can do that, be able to do that. But if you are someone who now have a good idea and you're looking for this infrastructure, please send us an email. We'll be happy to sit down and discuss with you about how you can use the National Practice-Based Research Network to do that. Remember, the Practice-Based Research Network is supported by the NISA member organization. So it is something that is available to everyone in the country that wants to write again. Again, each of those sites have a trained research coordinator. Each of those communities have what we call a community research engagement officer, and then we have a research assistant in it. So this is why the 36 site presenters, we get one on them. But you are able to tap into those by just sending us an email and we'll have a discussion. So just one thing before you go, for those people who are raising their hands, we are not going to take questions by raising hands. So one of the things people don't get grants is that they don't read instruction. So let's go back to that instruction again. If you want your question answered, put it in the Q&A. We will attend to that. Thank you.
Yes. Thank you, Prof. So to answer, there's a second question. We are second part to the anonymous attendees question. But before I read that out, I want to ask, what if there are people, and there are a lot of people on this call who are joining from out of the country, early career researchers, mid-career, late career, and they want to use the NISA ICON 3 practice-based research network? What's the possibility?
It's depending. The only problem is that the project can be done, it has to be done in Nigeria because that's where we have the participant there. But if they're out of the country and they don't want to do that project, they want to do it in that place, we also offer a consulting service at IVAN. And what we do is to work with you over a period of time to see what you have and help you develop the research environment section of your grant. So that is a service that we provide at IVAN. So all you need again is to write to Ivan and ask for that consultation, and then you go through the process, and then we will be able to sit down with you and be able to not just help you identify a very good environment, but actually help you to say how to showcase that in your writing. And that
okay, so the last part of the question.
Yeah, go ahead.
Okay. The last part of the question says, if you have an opportunity to choose where to work and do research, what would be your advice in this regard?
It depends on where you are at your stage. For example, at my career stage, I no longer do research that is one side. When I see studies that come out of Enugu and say this is a Nigerian study, I say no, it's a Enugu study. Or I see one that came from Ibadan and say this is Nigerian study, I say no, it's a Ibadan study. But one of the things at my stage is that I do not do studies that is not national. But that's not for everyone. If you're beginning your research, first of all, you can't have the money. Most of the grant I applied for, if it is not at least $2.5 million, I don't apply for it for myself. That's because it requires that amount of money to be able to do research across the country. But that's not everybody that comes out and get a $2.5 million grant. So I want to make sure that you understand that. So depending on where you are, I start with where I am. If I'm at university and I want to be able to, first of all, see what I can do in that environment. Most difficult thing is when you create to work for yourself. You remember when they used to say, you go to work in Nitel and you want to go and get your money from NIPOST, so or the road railway and you want to get your money from Nitel. No, you want to do things where you are. If you're at University of Benin and you're beginning your career, start with the patient with hypertension at University of Benin. There is no reason for you to start with patient with hypertension across all of Nigeria. You will get there as you improve on it. But your first thing may be, the patient with hypertension approaching and looking at stroke among patients with hypertension at UBTH or at University of Benin. So you can start from there and grow over time. So depending on your stage, Why? Because when you start going to those bigger studies, you will need to attract people who have a track record on those people. And then if you're writing me to join your research, there's only two ways that I join your research. One of them is that you are a scholar, you are a mentor, so that those are the people that are have so of all those 168 people that applied, the 10 people that will be accepted, I will spend my time. And this year we're trying to do it differently. So we're trying to accept 10 PhDs and 10 MBBS. So that would be 20 people, thanks to innovation from Professor Nyeka of trying to do this. I refused, but she insisted. So I vowed for it. So that she said, let it be 10 people, but let's make it 20 so that we can reach more people. So it's still your 20, it's still your 10, which I insisted on, but you're pairing them in a way to get more people. So we're going to do that this year. But for those people, I will be able to be on their grant in any way that they want me to, that helps them in a grant, to provide them that environment. You're talking about research environment, that also not just about facility, that also about your research team in a way that gives that, because they will score it in investigators, but they also score it in environment, because when you have an environment and you have someone who had experience, a track record, it provides also part of your environment. So for all of those people who have being CITES scholar, they know that I am on their grant, sometimes for no cost. Sometimes that's difficult to do because they're applying for small amount of money. And if you put 1% of my time, then the whole money is gone. Then if you put the 1%, then the reviewer said, I don't think he made enough commitment by 1%. So it's a chicken and egg, but we have found ways to make that work, to make that. So please send us an email in terms of those kind of things, and we can have that consultation about your specific project.
Okay, so Marvelous Ajayi is asking, he's saying, thank you for the presentation, sir. And my question is, does the principle of the concept note writing, which also apply to grant writing as pertaining to innovation?
So the innovation is part of the innovation. People always think about innovation is to think. I remember when I was doing a project and I was getting an award for. I was running the HIV program that Professor Nyeka mentioned in the state of Nevada, and for
Nevada.
5 years I actually had a philanthropist gave me $400,000 to start it, and the state said we match that for 3 years. So I got $1.2 million to start the program. So I started the program, and there was one goal. I said, we want to make sure that even though there are a number of children born with HIV in the state, we didn't want a child. So Nevada became one of the first states where there was no child infected with HIV. And I was getting an award as a local hero. And then one of my friends, who's a bishop from Nigeria, came to the award and he said, wow, Eche, you cured HIV in the US. I said, no, I didn't cure HIV in the US. The cure has always been there. I just applied the principles of implementation science to do what we need to do. So when people talk about innovation, it doesn't have to be innovation in the cure of HIV, in the cure of sickle cell disease on there, but actually in so many different things. It can be innovation in your approach that you're using. It can be innovation in the team that you are, how you're able to use the team to be able to, it can be, so in all of the aspects, there is an innovation that you can be, but most of the times where people fail to understand is the innovation in the approach. And they're thinking that innovation is just to know that nobody has ever done this. That's not innovation. That's exceptional innovation. But innovation, it can be on the approach you're using. For example, when we got our first NIH grant, for HIV testing, we went to churches to do HIV testing. We call it the baby shower trial. It was one of my popular, project that I've done. It was the one that brought me actually to NIH grant. I mean, we got 25 papers out of it. We didn't create the church. We didn't create the baby shower. We didn't create the baptism and the infant baptism. We just brought three of them together into a platform that we call the baby shower. And during that baby shower, we had all the three components and we were able to get our funding. So to think about innovation, you have to go beyond what nobody has done to what is innovative about the way you are doing it.
Okay. Yeah, so the next question is Akinola Odede is thanking you for the stimulating presentation. It says, is EASY an acronym? You didn't explain.
No,
yeah, so we're talking about the 5 easy steps,
the
which is
easy-
what we
easy-
have been taught today to write the concept note. So, sir, E
that is
stands
my
for?
that is my poor man to talk about the first E stands for my first name, Echezona, and the easy is the first 3 digits of my last name. So when you hear the easy steps, that's just something I I come up with an acronym to make it easy for you to remember. Because right in the US, everybody call me Dr. Easy. Because they stop at the three letters Easy E. So when I did it was easier to say Easy Steps. So that's what it is. But there is a publication that actually is coming out where we have this laid out. So that you can actually cite it in your approach to be able to do that. People have been asking me for that, so it will be out soon, and then we can provide those on our website too.
Okay. So there's a question saying from an anonymous attendee, thank you for this enlightening session. I'm an early career researcher in science education. Do I have a place here, especially the CJ Scholar program? And can I get a mentor or collaborator or collaboration?
So for things, we don't limit on anything. We have people from public health education. We have people from every kind of thing. We have people that a lot of them are smarter
Computer
than I am.
science.
We have people from basic sciences, political sciences. People forget that political science can be a science communication because if you're there, or how to do policy interventions if you're political science. So there is people from everywhere. What we do require as to be part of our mentee team, our scholar program, is that we have to have a mentor. Sometimes that would be a content mentor. So for everybody that is accepted to the scholar program, I act as a secondary mentor, but that is to provide the guidance on writing, the grind and all. But I'm not a content, I can't know everything. So sometimes we need people, if you say like you're a political scientist and you're working on the policy intervention, we want somebody who can mentor you in policy intervention, but where I mentor you in the grant writing part of it. So what has limited the number of people that we're able to accept has been the availability of mentor. And that's why I reached out to say, if you think you have that capacity to mentor, and there are characteristics of mentor, maybe in our next talk, we're going to talk about what the mentor is looking for and what the mentee is looking for. But the people to say, how do you find a good mentor? People say, well, the problem is to find a mentor. I said, no, you cannot say that in Nigeria. There's a lot of mentors. I said, the problem is to find a good mentee. And they say, what do you mean? I said, because I've been looking for one. And if you think you're a good mentee, tell me why you are a good mentee and write me a letter. That is how I got my first one. So write me a letter, show me your concept note, right? It starts with that. Show me your concept note. They say, this is my idea. And then I look at that idea, and that idea contains the 5 easy steps, and I have 1, 2, 3, 4, 5 that tells me what is it that you know the problem you're trying to address. You know what is known about that problem. You know where the gap is. You tell me what you propose to do, and you tell me how you're going to do it. You say, I want you to be a mentor. I'll be saying, yeah, here comes my mentee. So I am looking for good mentees too. So as people are looking for mentor, I am looking for good mentees. So the good mentee starts from this concept note. That's why we put this first. This is the beginning of our CTS Scholar Cohort 5, right, Professor Nyeka? Before
Yes,
the by next week, we will start
we're
our
kicking off
our
next week
our
fully.
12 month. So this is our first part, but we felt that the first part of it is to start with this concept note, because that is how you get your mentor. That is how you get your collaborators. That is how you have to put together an idea. Nobody can edit an idea in the brain. It
In the
must come from
brain.
the brain to paper.
Yeah. Okay. So we have one question before 2 related questions. Will there be more trainings on grant writing? Amara is asking.
Yes, there are. But once we start the Star Scholar program, of course, like I tell you, it's an intensive 24 weeks of didactics. So we do that. We provide all of this. Each of the grant writing section, whether it's significance, approach, we go into how to put together a mentoring team. So there will be that detail in the Star Scholar program. Again, that's why it's very popular. People who have gone through it, you have heard from them. You can also look at the website and see testimonials of people who have gone it. People who have gone. We actually have one requirement, one output for those. It's not to get the grant, it's actually to submit the grant. So we want people to be able to do that, but we know that also mentoring is required. So that's one thing. So what you might see, you see these trainings that come in at our monthly webinars, different ones. But if you really do want to have a detailed training, the CTS Scholar is a short certificate program that we're able to do. It's a 24 weeks for didactic, 24 weeks of mentoring, and an additional 1 year of if you get a good mentor and the mentor feels you're a good mentee, what we have noticed that the thing never stopped. Anybody that we have matched haven't stopped. They're still going to their mentee and they're still going to their mentor
A
and
mentor.
continue to them. That is why the mentor is important. Again, I can't stop saying it. If you can be a mentor, this is a platform we're giving to all Nigerians. Please be one that is there. We don't charge money for any of all the mentors are free. They provided. The only money that we charge is to have an administrative person that runs the program. One person that make sure that assignments are done, that the things are collected, that are done, and that's the only money. For the 4 years, we didn't charge a single dime. But when it became more detailed, more people coordinating all of those people, we needed a coordinator for it. Last year, we actually charged money for it. And we said, if you submit a grant, we give it back to you. I think they're in process of returning those funds for everybody that provided that money. But moving forward from this year, we charge a nominal fee to be able to keep one single person, the coordinator for the program that is there. All the faculties are volunteers, including myself and Professor
Yeah.
Nyaka, and so many of the people
Yeah,
that
so,
are
yes.
on the Zoom.
Yes, I also wanted to mention that for those who will, because all the emails will go out from tomorrow, for those who are successful, some already know, and for those who are not successful, another opportunity next year with cohort 6. But even if you didn't make the cohort, and for those who maybe just want to have a peep of what it looks like, the webinars are designed to also be part of the CETIA Scholar Program. So for Amaka, who's asking the question on the grant writing, a lot of the sections on grant writing will feature prominently during our monthly webinar. So just look out for the e-flyers and register and share the information. So, Prof, these two questions are similar. Someone is asking, for the PhD in implementation science, can a physician with fellowship apply without a master's degree?
Yes, so it depends. So we actually think so. It may take them a little longer period, but they can. That's one of the things if they have their MBBS and have their fellowship. So what it does, it will take it because an element of those masters, because the truth is that the masters is incorporated into the PhD that is there, but it will take you a longer time because especially if you have no background in that. If you have an MPH, you will find out, some of the courses you already took in your MPH that is elective. You may decide not to take a lot of them because you already have them with your master's and MPH. But let's say you did your fellowship, you didn't have an MPH and you want to do the PhD. Yes, it just might take you a little time because you may need to cover the certificate program in implementation science. But
Okay,
that's
so
only
someone
for those
asked,
people who already have a terminal degree, whether a PhD, because people have PhD and wanted to do PhD in implementation science from a different area. We have had people who have a PhD in another different area and wants to get a PhD in implementation because they want to focus on implementation science research. So that's one of the things. Yeah.
okay, so someone wants to know if the PhD program has commenced. The answer is no, but wants to also know the requirements and the process for application. We had a webinar for that
It is going to start this year
previously.
because the announcement is going to come out this month or next month for the application. The session it will definitely start with this academic year in June in September. So be out looking for it. The call for application is going to go out this May, likely by the end of May. And then we start the selection process. Again, we're only looking for 10 people. So it is going to be quite competitive. But again, the 10 people is that if we want to do something, we want to do it well. So everybody that is accepted into the PhD must have a mentor. So those are the things that make us limit the number. It's not because of anything, but because we want to make sure that there is a lot of people.
Yes, okay. Chimezie is thanking you for the presentation, and he says, I'm curious whether social scientists have a feature in this line of research. For example, I'm a researcher focused on gambling in Nigerian populations. Do we have a place in this space?
Yes, actually, a really interesting question that you have. Let me give you an example. We actually have a qualitative core that is led by a social scientist. He's a medical sociologist and really leads that team a lot of. So it's a core that we're actually looking for individuals that want to work in that core and join us as a team who have the qualification, the training in in a qualitative core and in so many different things. But social sciences are a critical part. Humans are social animals, right? So tell me about scientists. Gambling has a lot of things. I can tell you connection between gambling and depression. I can tell you a lot of difference between gambling and drug use. I can tell you depression between gambling. So there is social science is a very, very important part of what we do. If you're looking for a home, this is actually a home. And inside the home, you actually have a really nice parlor, which is our qualitative core. But if you don't do qualitative research also, that does not mean as a social scientist that you're not. Maybe your focus is on implementation science. Maybe it's on implementing intervention to reduce gambling. That is an implementation science then, and it doesn't, and implementation science does not really end in health. So yes, you do have a home.
Okay, so Osei Mensah, from our neighbor from Ghana, is thanking you for the opportunity and this presentation, and says that he noticed the presentation is tailored towards health sciences, and he wants to know if there's any other information for someone like him with an agri-business background. How can this mentorship, the CJ Scholar Mentorship Program, be of benefit to them?
So, like I said again, there is no limit to the topics. So, as long as the only thing that we don't have ability to do is basic sciences, when that basic sciences is in the lab alone. But if you actually build in, like some people will tell you, if you actually have humans, so if you're only working on rats and rabbits, we don't have a lot of that. But if you're actually going to be dealing with humans, so whether it's in the social part of it, in the whatever, even in the basic sciences, we have individuals looking at diseases I've just heard of, learn more of. The last time I heard of them was in medical school. So it is not only focused on health, but he has to focus on implementation science. That's where our expertise is. We are not everything. And then there are many, many programs like ours in Nigeria, for example, that do that. But what we do that is exceptionally interesting is that implementation science cuts across from education, from agriculture to business to implementation science. Remember, is the study of how to make things that we know that work. So the only thing that is important is that they have to have been an evidence base that stuff work. So we are not going to be doing. We have a different program for clinical trial where you're trying to test something that works. But in implementation science, you're looking at things that work and how to make them work in our environment and in our context. So it is not limited to health. So you know, but I'm a health person and I'm the one speaking today, so I'm talking about it. But if Tonia, I think we can continue with the question, but maybe you can bring up what is coming up in the NISA Research Week.
Okay.
The reason I brought that is that
Research Week. Okay,
a lot of the
can you please talk about the NISA conference first while I'm setting it up?
Okay, so the NISA conference again, we have been doing this. There are sessions in NISA conference that we brought in there that is you see the implementation science, you see the organizations we are going. We are trying to bring in Initial Research Week implementation science alliances like ours from all the 5 continents. So from North America, from Europe, from Asia, from Africa, and from Australia. And they're going to be talking about different things. So you can see much more than health, which is what I focused on today because of the examples that I use. But I can tell you that each of those things that I described there, you can take. That's one I like implementation science. It is disease agnostic. It is not a specific disease, but it's also not a specific area. It just have one thing in common. They have to think about how to make things that we know that work, the evidence that work, how to make them work in the context where we are implementing them. You're muted.
Yes, thank you. Thank you, Prof, for just giving that brief summary about the NISA conference in September.
I gave the
so
date,
we have
September 2 to 4, right? September 2 to 4 in Abuja
from
Continental.
The 2nd, yes.
Yeah, in Abuja. Please go on the website, nisaresearch.org, and register for it. And or follow NISA on the LinkedIn. That is there, and that's something that is there.
I think the call for abstracts, I think it has closed. Yes, we've closed it.
Yeah, the abstract to abstract.
We had a record number coming in.
But registration is open. This year, we have the highest abstract submission we have had since we started 10 years ago. So there is a
Yes,
need
that's
for
true.
it. And we are serving that purpose since one of the things, since a lot of people can travel outside of the country, we are bringing a lot of people from out of the country to Nigeria. And that's what we're trying to do more and more. Hopefully the politicians will give us some safe environment to do that.
Yes. Okay, so the NISA Research Week is a standard research week, 1 week, usually the first week in June of every year. This year is from the 1st to the 5th of June. Yes, from the 1st to the 5th of June this year. And usually what happens is that for every day, we have a research topic, apart from the general theme of the conference. For this year, the general theme for the NISA Research Week is when evidence does not inform policy and practice, how implementation science can make a difference. So for day one, well, our panelists will be looking at diagnosing the problem, and they'll be talking around the theme, why evidence fails to travel, understanding the persistent gap between research, policy, and practice. And we have individuals well-versed in implementation science from the Global Implementation Society, as well as from the Nigeria Implementation Science Alliance. That's what we're going to do. The second, and I'm going to stop and share the second day. For the second day, and here we go, we're going to be looking at policy systems and power. So the title for the second day would be Evidence Meets Power, Navigating Politics, Incentives, and Decision-Making in Policy Implementation. For the third day, we will be looking have another set of very erudite implementation scientists join us. But it's slightly different on this day because we're going to be having a mix of health and non-health. So day 3 will be looking at implementation in real world settings. And the title for what the topic to be discussed that day will be From Guidelines to Ground Reality, Adapting Evidence for Complex Health and Non-Health Systems. So for those of us who are on this call who are feeling a bit off that most of the things we're talking about is health, the NISA Research Week will also include non-health components like education, like communication. Then for the fourth day, we'll have another group of very erudite speakers that will be joining us to talk about, we'll be looking at equity. And we're happy to be having 3 very highly cerebral individuals from the EQUIP network to be talking about whose evidence counts. Centering equity, community voice, and lived experience in implementation. And of course, for each and every of those days, we'll be having one of our chief executive officers, our CEOs from the Nigeria Implementation Science Alliance. And for the final day, we're also going to be having another group of implementation scientists from out of this, the scope of our, or out of this region. And as I share now, day 5 is going to be looking at action and accountability. And these panelists are going to be discussing making evidence stick, tools, strategies, and metrics that drive sustainable policy and practice change. So hopefully before the end of next week, these flyers and the main flyer will be out. The registration link is ready, but we will send that out, and we implore you to register and share among your colleagues and research enthusiasts, implementation science enthusiasts, and get prepared. It is 2 hours every day from the 1st to the 5th, 4 p.m. to 6 p.m. Get in all your questions and get them ready to be answered. Prof.
I think, what I've had over the last 5 years as this has been a week, 2 hours a day for each week, either for the week that people that have, the NISA Research Week is all virtual. It's not a conference. So it is 2 hours every day. So in your day, you go to work, if you set out the time and spend 2 hours of your time each day, Monday, Tuesday, Wednesday, Thursday, Friday, 2 hours each day. But what I've heard from people, it has been the one excellent week of learning for them. And that is usually before our conference comes in. The conference is in person, and there is a virtual component to that conference. Yes, there is. So when you go online, you will see that. Although I do think that an in-person one is really beautiful because there is a lot of network that is there. You get to eat nice food and you get to have meet people that you read their books, you read their articles, and I remember somebody meeting Greg Aarons at the meeting, and they were talking about APIS framework, and they were, I say, have you? You say Greg, and I say, have you ever met Greg? He said, no. I say, well, today is a lucky day. Here is Greg, and the person was screaming. So you get a chance to meet people. You read their articles, you read their books in implementation science. So throughout this time, if you're talking about the ERIC strategies, you see Byron Powell, who was the first author for that. You see a peace framework. You see people that are there. We bring them down every year. Last year, or was it last 2 years? We brought in 5 different institutes from the NIH. The next one we're planning for next year, we're bringing in funding agency. We tried to do that this year. It didn't work well, but we're planning to help. We can do that. Bring in again people from NIH, from CIDR, from NINHR, from all the funding agencies across the globe. What we want is for Africa to have its own thing. And then, of course, as you know, we are working to really pull a lot of the African countries to strengthen our things with them so that this platform are not just focused on projects in Nigeria. We are looking for individuals who are in other African countries who have, recently NIH has looked at the things we have done at NISA. I have given some small grants to different countries. One of the things we're going to do is that we're going to invite those countries. I call it LINSIN, Local Implementation Science Network. They wanted them to build things we have already built here for 10 years. So what we're giving them about a year to get started, and we're going to invite all of them to this network so that they all can present here. You get to meet them in a different country. And the whole idea is that we're going to use that to build the African Implementation Science Alliance. Hopefully that will be something that is and NISA will be, of course, on there to be able to lay down what we have learned in the past 10 years. I think we have 4 more minutes. We planned this for 1.5 hours from 8 to 8:30, and we are 4 minutes away. And
yes, one quick question, which
questions?
I think you should, I think we can answer is, Priscilla, thank you for attending. She's asking, the abstract for the NISA conference, are they only implementation science based? I should say yes, because it's an implementation science conference.
But they are not implementation science alone in health. So we have implementation science in vaccines, in TB, in education, in business. Think about agriculture. I guess I said if you're manufacturing food for humans to eat, nutrition is a human specialty. So the way I talk about it, everything in the world is about humans, it's about health. The only thing. So whether you are talking about engineering, you're talking about anything, at the end of the day, you're building for health, you're building for human. So it's just that we focus on implementation science, recognizing that there are many other groups in Nigeria that focus on other aspects, but we wanted to make sure that the areas we focus in were the best of Africa and the best. We can sit down from people that in our team at the NISA Implementation Science Alliance, the CEOs that support that program, each of them. I remember the first time when I brought all of them together to start this program, and they say, who is going to fund it? Okay, Wanyan was the CDC director for Nigeria then. The first time a Nigerian was a CDC director, and he wanted to fund this program, NISA, and I said no. He said, Eche, what do you mean? I said, because if we want to grow up, we need to be able to fund our stuff. It's not every time we go begging to fund programs that if they cancel PEPFAR, then we don't have a program. So this organization have made sure that irrespective of, we have this conference every year, even the year PEPFAR USAID was canceled. They felt it was even more important to have this program. Like I said, this year we got the highest abstract we have ever received across all African countries. So those are the things. It's time for Africa to begin to organize some of the things and be able to, wear big boy pants and be able to have his own program and fund his own program. That's a thing that we have to all learn how to do. So again, we do want to say something to everybody that is here. You may also have a chance that you have some finances and you want to sponsor someone that is doing the City Scholar. So we will post all the names, all the people that we selected, and if you want to sponsor a scholar, we can name that scholar after you. So that position can be named after you to say, I will support a scholar to learn this stuff that I've learned. So that's an opportunity, a way we can keep these things going. Again, remember what I said, none of the mentors are paid. They are all volunteers. So you are not paying any mentor. But what it does is to support the administrator that make sure that all the Zoom calls are set up, all the meetings, all these things that we do here that are set up. So thank you everyone for attending, and I hope that you will come back again to our monthly webinars. Thank you and goodbye.
Yeah, thank you. Thank you, Prof. And thank you everyone for staying to this time, and have a nice rest of the day. See you next month at the NISA Research Week, and bye-bye.